Dr. Ashley Johnson, and I'm an OBGYN here at the Women's Clinic.
And I'm Eric Holland. I'm an interventional cardiologist at Baptist Heart, and we're here today to talk to you about women's heart health.
Being at the end of February and American Heart Month, we wanted to talk a little bit today about how we can prevent heart disease in women. We wanted to bring this to everyone's attention because it's one of those things that can slip through the cracks at our appointments, and kind of give you some rundown on how you can best prevent heart disease. So we were talking a little bit before we got started with this video about coming in for your annual and what all we're looking for. We're checking a blood pressure. We're doing some labs on you, which includes your lipid panel, looking at your cholesterol and triglycerides, and all of these are extremely important things for us to check when it comes to prevention of heart disease in women. And we also talked a lot about family history and how sometimes we get a little tied down in breast cancer risk, ovarian cancer risk, and your pregnancies, and we forget to mention these family history of strokes, heart attacks, early heart disease, and other things that can be super important for your heart health that help us work with the cardiologist to get you to the right screening test. We hear a lot about diet and exercise for our heart health prevention. I feel like we see that on the news and magazines all the time, but what does that really look like? And I think we wanted to focus a little bit on what does a heart healthy diet look like, and it really is a lot less processed foods, incorporating more omega-3s in your diet and fibers.
It's one of the questions I get the most in clinic, and I think it's the hardest thing to do. I think,
yeah, what can I eat?
In some ways, it's easier to get a prescription for a medication, right? It's hard to eat well. It's hard to take the time to plan that out. It's expensive. It's tough. I think the focus, and what I tell my patients is revolving your diet around a Mediterranean diet. So that's green leafy vegetables, fruits and vegetables. That's staying away from red meat to the best you can, right? Using olive oil specifically, trying to cut out animal fats. It's not to say that you can't have those things, right? We don't want you to be, miserable, but we want to revolve our diet around cutting out red meats to the best of our ability and really trying to cut out specifically, like you said, the processed foods. That's really what's going to drive up the cardiovascular risk, increase blood pressure. And I think, based on what we know about diet, that's going to give you the best chance to reduce your long-term risk for cardiovascular events. So things like preeclampsia, things like high blood pressure during pregnancy, and other conditions such as PCOS can increase that risk. As we get kind of a little bit further along, things like rheumatologic disease, so rheumatoid arthritis, lupus also increase that risk. And so when we think about what can we do to reduce that risk, the best way to do that is really getting in, talking to your provider, thinking about what symptoms am I having, and then getting those labs, right? Getting the cholesterol checks, getting the blood pressure checks, and then thinking about the care as overall risk.
Right. And I think it's a collaborative effort. So when we go through your obstetric history, even if you're in your 50s and we're meeting for the first time, talking to us about how did you have preeclampsia? Did your blood pressure stay elevated after delivery? These are all important things that we have to look at. With PCOS specifically, increased risk of diabetes and elevated cholesterol and triglycerides specifically affect your cardiac risk too. So we want to focus on getting a really good history and focusing on these things so that we can assess your risk and then get you off to Dr. Holland and people at Baptist Heart if we see that you're high risk and need extra screening. Since we've talked a little bit about family history, we know that women's symptoms of heart disease look different than men. So can you talk to us a little bit about what that might look like for females versus males and what signs and symptoms to look for with heart disease?
Sure, yeah, it's a great point, and I think that this is something that we're learning more about, right? Is something that for a woman, it may not be the left-sided chest pain that you typically hear about. It may not be pressure on the chest that's common in men. It may be a little bit more subtle. It may be some nausea. It may be some epigastric pain or acid reflux symptoms. It may be as simple as shortness of breath and increased fatigue. And And we know that women are more likely to present with those symptoms, and because of the atypical symptoms, they're more likely to present later. And that's important, is a lot of times when we find these patients, when we get these patients in the hospital, these symptoms have been going on for some time, and they've been attributed to something else, right? Is it lung related? Is it a little less active? Is it GI? A lot of times, a lot of these symptoms get passed off due to things like anxiety, actually. And I think it's important when you're having these symptoms, when you have these questions, to bring them up. We can't treat what we don't hear about.
Right.
And so when you have concerns, when you feel like something's not right and it's getting worse, letting your provider know,
So
getting in to see us,
that.
so we can work through it and we can get ahead of it. I think that the way to do that is getting in and focusing on getting more information, and that'll help guide how we can keep you safe today and tomorrow, and ultimately getting a plan in place to keep you safe in the long term.
Right. So don't ignore these symptoms. We know that as women, we get busy, we have children, we're looking out after everyone else, but these are the symptoms that can look like, I've just been taking care of my family. So, balancing all of that and making sure that you call to see one of us if you're having persistent symptoms.